Right. The indictment alleges that Dr. Robert Levy entered incorrect and misleading diagnoses for 3 patients, leading to their deaths, and on 2 occasions said that a different pathologist looked over his work and agreed with him, but actually did not. Now, back in 2016, Levy appeared to be intoxicated while on duty, and a drug and alcohol test revealed his blood alcohol content was .396. That's when the Fayetteville VA suspended his privileges to practice medicine, and he started a 3-month inpatient treatment program. He entered into a contract with a Mississippi medical board to return to practice, having to send urine samples and blood samples through the mail. Now, the indictment alleges that on 12 occasions he used a chemical substance that's actually not meant for human consumption and can actually be lethal to achieve a state of intoxication, but not detectable through routine drug tests.
The 2-M-2B that he used was, again, a substance, not a drug, a substance, allowed him to receive the feeling of intoxication, but it would not show up on any type of urinalysis test. So again, part of the scheme was his concealment of this by using that specific substance in order to mask the results of the test.
U.S. Attorney Dak Keys tells me that Levy returned back to Arkansas about a week ago after being out of the country. He was possibly teaching at a medical school. Now, with all 31 counts, Levy faces up to 524 years in jail and a fine of $7.75 million. We're told he has not cooperated with authorities since his arrest, and the Inspector General tells me that this is exceedingly rare for a healthcare provider. Levy's trial date is set for October 7th. We're told as of this morning he does not have counsel representing him. Reporting live in Fayetteville, Kelly O'Neill, KNWA, Northwest Arkansas News.